Hello, my name is Payam Tarabi. I'm a GP in Southwark and a clinical lead for Clinical Effectiveness Southwark. This is a short 3-minute update on managing patients with suspected COVID. There is now a merged guide for Southwark GPs which is available via the link below and on the South East London GP website. Building on learning from where there have been outbreaks in primary care settings, the Southwark and Lambeth Infection Prevention and Control team have developed a briefing pack for primary care. This includes information on what personal protective equipment should be used in different settings. It reminds us that fluid-resistant surgical masks should be used and that cloth masks are not recommended for staff working in primary care. It also reminds us of the vital importance of ventilation in ensuring that we reduce the virus's spread. Point number 2. Both suspected and confirmed COVID are notifiable diseases. If you suspect COVID, use our Southwark Suspected COVID template so that you can code it correctly and structure your documentation. Complete a Notification of Infectious Diseases form or a NOID form on DXS and email that to the London Coronavirus Response Cell. Point number 3. Consider using a COVID monitoring diary in eligible patients, such as those who are aged 65 and over or those who are clinically extremely vulnerable. You can also use your clinical judgment to decide other patients who may benefit. This is about finding people early on in any deterioration so that we can intervene quickly and get patients the right care at the right time. Patients should be supplied with a pulse oximeter using the LOAN programme and a monitoring diary which is in the links below. And this includes information on where to seek help by oxygen saturation level and further information about other symptoms that patients should look out for. The full details of remote monitoring are on pages 7 to 9 of our guide. As a bonus point, don't forget to check what equipment a patient has at home, like BP machines or other things which might help inform your management as you're managing their COVID. Consider using a desaturation test, such as the 1-minute sit to stand test. This involves asking the patient to alternate from sitting to standing as many times as possible within 1 minute, and then measuring their oxygen saturation. It shouldn't be attempted if the baseline oxygen saturation is less than or equal to 96%. A drop of 3% or more, or a drop to below 93% is deemed significant. Point number 4. We all know this, but it's really important to always use our clinical judgment. The pathway is there to help guide us, but this is a new illness which we are still learning about. So if you're worried a patient is unwell, don't be overly reassured by the numbers. Thank you very much for listening, and further details of everything we've discussed and a wealth of other information is available in the guide and in the links below on the South East London GP website. Thank you.